Good afternoon, ladies and gentlemen. We're here at Hawkesbury Dentistry this afternoon. We're here talking to Dr. Steve Cross. How are you, Steve?
Terrific, Sean. Good afternoon.
About the KaVo OP3D Pro, and we'll look at the case of the week. What have we got today, Steve?
The case of the week this week is a gentleman that presented with a pain on his upper right 6, on tooth 1-6, and the OPG showed some bony change within the roots. It's an old root treated tooth. From way back somewhere else, and once I did the 3D imaging on the KaVo OP3D Pro, the true diagnosis of what's going on here was easily seen. Just looking at the combined 3D image here, I'll rotate it slowly, and you can see, one can see in this area here, the actual abscesses are breaking through the bone. The soft tissue was very fluctuant and sore here. And if you rotate it slowly, you can even see from the rear of the tooth, the bone's all gone through here as well. It's so it's it's actually breaking out in all sorts of areas of this tooth, but particularly on that buccal view. And once I show the patient this, you can really understand what's going on. So I'll make this down to a small size and look at some of this is the multi-plane combination here. I'm looking at, in the sagittal view, the severity of this abscess is quite clear.
It's amazing, isn't it?
Yeah, it's a very clear picture. If I go up and down on the axial view here, just going back, you'll see the abscess taking out virtually taking out the buccal wall of these teeth, and even in the coronal view here, you can see just bring it into perspective, see the size of this abscess. It's actually engaging into both roots. The prognosis is basically zero for this tooth. Yeah, so I just thought it was a very clear image. The practitioner can really get value out of these three views, and the patient very rapidly understood the level of severity of damage.
Fantastic.
Yeah, very
so having the system in-house, obviously compared to years ago, allows you to have a really smart workflow from not referring the patient out to being able to do it here and now, do a treatment plan and get a treatment plan acceptance.
Exactly. Years ago we used to send patients from North Richmond to as far afield as 5 Dock and Canada Bay. It's about 65 kilometres to get these pictures, and now we can do them virtually in a matter of minutes, have a diagnosis, and equally importantly, to have the patient understand totally what's going on with their dental problem. Okay.
And having a system that you can pick the most appropriate field of view, like you've got the system set up here, so you can take what we're looking at there now, which is 5 by 5, all the way up to 13 by 15 for airways.
That's right. Look, each individual patient problem necessitates a certain field of view and energy level. This is a very small field of view with a very high resolution. If I'm doing third molars, I tend to take the 8x15 view at just the standard resolution, and that gives me more than enough information about position of Ian, position of the lingual plate in third molar extractions. Or if I'm doing implant work, where I'm doing a combined surgical guide implant therapy for a person, like sometimes I'll do the 6x8 or the 8x8 view, and of course for the airway analysis and volumetric analysis of sinuses and airways, I use the 15 by 13.
Fantastic.
So we always have a field of view which pertains to the correct positioning for the job in hand, and it's all in-house, and the workflow is excellent.
Great. Once again, thanks very much for talking to us today, Steve. We'll speak to you soon.
Thanks so much.